The next session is SOGP WHO session. Thank you very much to Pakistan WHO team and our regional team from Aga Khan University Hospital and SOGP office bearers for being here with us today for this very important session of WHO and SOGP. May I request the chairs of the session to take their position on the chairs. Professor Lubna Hassan, past President SOGP, very much involved with WHO as a consultant in her own individual capacity as well as wearing SOGP hat. Madam, you have to chair, madam, on this side. Professor Sara Salim, a researcher, a public health specialist, a very reputable name when research comes to Pakistan and public health. Thank you, madam. You have to chair the session. Dr. Ellen Thom, you have to chair the session, Dr. Allen, from WHO Country Office, Pakistan. Thank you for traveling for this session. We are really grateful for WHO Pakistan Office for being a part of this important discussion and this session of SOGP. Professor Sadia Ehsan Pal, Executive Member, Academic Board Member, SOGP, and also a WHO consultant in her own capacity. Okay. For the panelists, I'll request Professor Khadija Bano, Treasurer, SOGP, and focal person of WHO COVID study at JPMC. Professor Sayyada Batul Mazhar, focal person of WHO COVID study and various registry groups of SOGP. Professor Shamsa Humayun, focal person, Gangaram Hospital for WHO COVID study, and also chairing various registry, especially maternal and perinatal deaths, surveillance and response registries of SOGP. And Professor Rehana Rahim from KPK. Okay. Professor Rehana Rahim is the focal person of the WHO study at Lady Reading Hospital. So we will start the session with a recorded message of Dr. Faisal Sultan, Federal Minister of Health, for this important session. And we are grateful, sir, for your message for us on this conference, which is very valuable to us all. Thank you.
Pakistan's COVID response has been appreciated across the world. With timely procurement and efficient distribution of the vaccine, we were able to protect thousands of people from the virus. The government of Pakistan provided vaccines free of cost and created extensive guidelines regarding its usage, considering age, the gap between two vaccine doses, the need for a booster, and so on. Vulnerability to the virus was at the forefront of decision-making. In April 2021, the Ministry of National Health and NCOC included pregnant and lactating women in the COVID-19 vaccine program. These vaccines are safe and effective for pregnant women and lactating mothers, but vaccine hesitancy amongst this group was noted by us. The vaccine also has no side effects on fertility, either for men or for women, and does not cause miscarriage. And to counter misinformation and vaccine hesitancy, we created regular reminders, various infographics, animated videos, and direct video messages, which proved to be effective in countering many of the myths. Audio messages on radio, ringtones, television commercials were also used to spread awareness. The Society of Obstetricians and Gynecologists of Pakistan took a position statement on COVID-19 vaccination and was one of the first to advocate vaccination during pregnancy in Pakistan. The SOGP webinar with the Ministry on COVID-19 vaccination in pregnancy was conducted to involve all health providers dealing with women's health. And the Ministry of National Health Services, Regulations and Coordination collaborated with partners like the WHO for vaccination and advocacy on social media. The Samra Noor initiative has been doing good work during this time. On the 21st of August, NHSRC and the Samra Noor initiative reinforced efforts and issued a statement elaborating that COVID can be dangerous for the mother and the baby, especially in the third trimester. The ministry and the Samra Noor initiative also engaged in a countrywide advocacy campaign through posters, flyers, and via social media. The government and private hospitals were also provided with the IEC material. And together with the ministry, SOGP, and the Samra Noor initiative, vaccine stamps, updates on the booster, outreach vaccination drives, and repeated regular messages and reminders had a positive effect on vaccinating pregnant women. I'm pleased to see that these initiatives improved women's lives and their families' health. Thank you very much.
So next is Dr. Palitaha Mahapali. He is the country representative of WHO. WHO representative and head of mission in Pakistan, Dr. Mahipala, is online. He's going to talk with us from his office. Thank you, sir, for joining us today.
Thank you. Am I audible to you?
Yes, sir, we can see you and we can hear you well.
Great. The distinguished members from the Society of Obstetricians and Gynecologists of Pakistan, research team from Aga Khan University, esteemed members of academia, colleagues and friends, ladies and gentlemen. I am extremely privileged and truly honored to join you today. I am pleased to hear the government commitment on response to COVID-19 as stated by the Honorable Minister Dr. Faisal Sultan. The coronavirus pandemic contains an encouraging surprise. It is often said that extraordinary times call for extraordinary measures. And we are witnessing every day the heroic efforts of physicians, scientists, nurses, medical workers, public health professionals, and the public to manage enormity of COVID-19 in our communities. Extraordinary times often need collection of facts and evidence and examination of research to respond scientifically, which has been foundational in medicine since its origin. Some have called the response to the pandemic a war. We must ensure the voice against the virus, not against science. It is science that has brought some proven treatment for COVID-19. It is science that has brought effective vaccines. Evidence-based actions are important to fight this disease, as all of us agreed upon. My sincere appreciation to the Society of Obstetricians and Gynecologists of Pakistan for organizing this important international scientific conference with a theme that is so relevant and pertinent in the current era. COVID-19 has hit the world hard beginning from December 2019 and continuing today with different strains and complexities, and the pandemic has continued for more than 2 years now, since women are among the key vulnerable populations in any humanitarian crisis. COVID-19 has also impacted women's life, both directly and indirectly to a great extent. I am glad to see that SOGP has provided this excellent platform to take a deep dive into the effects of COVID-19 on women's health in the country and also globally. I would also like to acknowledge the excellent collaboration and support extended by SOGP as WHO launched its global research entitled Prospective Cohort Study Investigating Maternal, Pregnancy and Neonatal Outcomes for Women and Neonates infected with SARS coronavirus 2. Your keen interest and zeal made it possible to include 4 major public sector hospitals caring for large number of pregnant women during COVID-19 pandemic. The study has included both public and private sector hospitals, making the data more robust and representative. Ladies and gentlemen, I would like to take this opportunity to appreciate and recognize the great effort of the galaxy of experts involved in this research, design, planning, and implementation for their wonderful contribution. The impact of SARS coronavirus 2 in pregnancy remains to be determined, and a concerted global effort is required to determine the effects on implantation, fetal growth and development, labor, and neonatal health. Asymptomatic infection present a further challenge regarding service provision, prevention, and management. I also deeply acknowledge the commitment from AKU, SOGP, and National Institute of Health for the exhibition of excellent collaboration among public and private sector institutions, professional associations, and the World Health Organization for delivering the much needed global evidence. I hope and pray that your strong efforts will make the research very successful and achieve the intended outcome. I wish you a great deal of engagement today. I stop here. Thank you so much.
Thank you very much, Dr. Mahipala. Your presence and your message today to us means a lot to us. And we really are grateful for your constant support, especially for our COVID-19 study. And we look forward to your support for other upcoming initiatives of SOGP with WHO Pakistan and regional team. Thank you again. I would now like to present few collaborative efforts of SOGP with our WHO country team and other professional organizations and other associations. So as soon as the COVID struck, we are all listening to it since 2 years. A lot of questions were coming up: how to deliver, what to do, how to protect ourselves, and how to deliver services to our very needy patients who were there all the time. Antenatal and interpartum care was declared as essential services, and SOGP, as the largest professional body, was feeling responsible to do something about it. So the academic board and the COVID-19 core group was given this responsibility, and we are grateful to them that they came up with these management guidelines with adapting them from WHO, RCOG, ACOG, and other reliable resources. So we are thankful to Ministry of Health Pakistan, who and with their team, Dr. Kutsia from WHO office, they were all the time with us, and we developed these management guidelines. We acknowledge our working group, and we acknowledge Dr. Kutsia Uzma, Dr. Mariam Iqbal, Dr. Umaira Mansoor, and all worthy academic board members and our executive board members who helped us a lot, not only to develop, but later to disseminate them through various web-based as well as face-to-face based activities. The data collection template for experience sharing was also adapted from WHO form and from all the ministries of health of provinces as well as the federal ministry. So this was our first response to develop guidelines, and then we gathered data, and then we started to disseminate through web-based meetings and a telehealth helpline. We continued to deliver the awareness messages all through the various pharma-sponsored as well as professional society-sponsored activities, and we learned how to deliver lectures live on Facebook page, how to do the virtual remote meetings through various platforms like Zoom, and then to put them on SOGP Facebook page live for all our members to chat with us right at that time. And at the same time, we also developed certain position statements. This was Reproductive Health Helpline, which was done in collaboration with Population Council, UNFPA, Aman, and SOGP. We trained the providers who were consultants. All of them were FCPS and MRCOG consultants who were trained how to deal digitally an online helpline service, and those doctors were put to rota of 24 hours, initially 9 to 5, and then 24 hours through a WhatsApp message as well, where patients can post their photographs, and the consultants at Aman office, along with SOGP support, were all the time available to answer to those calls. We also did the virtual training on infection prevention and PPE in collaboration with JPIGO, Government of Sindh, FP 2030, and UNFPA. The contraception awareness and World Population Day celebration was also carrying on through our web-based meetings. We did not only national but international webinars with SAFOG and other professional organizations like AOFOG and FIGO. When everyone was falling ill, the doctors were one by one, we were receiving messages from them that I have tested positive. The WhatsApp group of all the units were busy having reports of their candidates and their PGs who texted us that I have tested positive. We were just nowhere. Suddenly, there were days when either 10 to 12 doctors were absent from duty because of their medical leave. And at that time, the undertraining midwifery students of various midwifery schools were put to training for essential birth services and essential newborn care by SOGP, Aman, and JPMC. We went with provincial media briefing while being in lockdown how to deliver respectful maternity care. Because when women were arriving, they were testing positive, we were being insensitive, we were being very fearful, and at times the right of the woman were being hindered. We were not able to provide the RMC in its real sense. So this provincial media briefing with so many media representatives in collaboration with White Ribbon Alliance and Government of Sindh really went a long way. And our doctors then came up with another promise to themselves that they will continue to deliver respectful maternity care, all essential services as they have promised. So breastfeeding was also advocated as per WHO guidelines. We even touched the gender-based violence and very sensitive topics like child sexual abuse through a webinar which was very well attended with consultants on adolescent gynecology from Pakistan Pediatric Association as well as Aga Khan University team. Dr. Iffat Ahmed from Aga Khan joined us. I'm grateful to Dr. Mariam Iqbal, who's among the audience today, that we did this very sensitive topic of child sexual abuse, especially during COVID pandemic. We tend to forget other underprivileged people when we are working on our own selves. Now I am coming to the position statements and registries of SOGP with Health Lab, for which we are looking forward to WHO country office to hold our hands, and we can start these initiatives on a bigger level if WHO office is willing to work with SOGP. The labor care guide module of WHO is being adapted for various trainings. We have done few trainings in our own capacity with some sponsors locally and internationally, but we definitely would need your support in this regard. The position statement on vaccination of pregnant women, as mentioned by Verdi, Federal Minister of Health, has also went a long way. And the ministry needed to change their own statement after our webinar with representatives of WHO and Ministry of Health. So we are grateful to WHO team, to the regional office of WHO at Aga Khan University Hospital, and to all SOGP senior members at various provincial levels that they have taken up our message and our vision to propagate the mission of SOGP for women health and awareness of our healthcare workers on a wider background. Thank you again. May I now request Dr. Salim Jisani to present the current WHO SOGP Aga Khan study, which is being conducted at 4 provincial hospitals in collaboration with WHO, SOGP and Aga Khan team.
Assalamu alaikum and very good morning. And thank you all for giving me this opportunity to present our study at this forum. I am going to present the WHO-funded prospective cohort study investigating maternal pregnancy and neonatal outcomes for women and neonates infected with the SARS-CoV-2 in Pakistan. The principal investigator of this study is Dr. Sara Salim from the Department of Community Health Sciences, Aga Khan University. Among the co-investigators, as it is a collaborative and countrywide study, we have with us the senior faculty as the co-investigators from the Aga Khan University, Jinnah Postgraduate Medical Center, Sir Gangaram Hospital, and Pakistan Institute of Medical Sciences and the Lady Reading Hospital. We are working in collaboration with the WHO Country Office, the Society of Obstetric and Gynecology, and the National Institute of Health. As we all know that the COVID confirmed cases are rapidly increasing around the world. Since its declaration as the public health emergency of the global concern in January 2020, various studies have been conducted around the world. However, there is limited data is available, particularly from the low-middle income countries, to indicate that the pregnant women with the COVID-19 are at increased risk of severe disease and complications. Recently published systematic reviews and the meta-analysis have failed to provide any conclusive evidence from mother-to-child transmission. And to estimate the risk of mother-to-child transmission of the SARS-CoV-2 virus during pregnancy, intrapartum, and postpartum among mother neonate pairs. Next. To describe the maternal, perinatal, and neonatal and postpartum outcomes among women who receive at least one dose of COVID-19 vaccine during pregnancy. The secondary objectives.
बस ठीक है वो सैयदा खान चलेगी प्लीज अब आप हट जाएं
Okay.
आप कैरी ऑन करें डॉक्टर सलीम
ठीक है
सैयदा will reach at you.
ठीक है. To estimate, the secondary objectives are to estimate the cumulative incidence of asymptomatic and symptomatic COVID infection and characterization of the clinical course, to describe the viral presence among various body fluids and tissues, to describe the presence of virus in neonates born to infected women, and to characterize signs, symptoms, and disease course of neonates with the COVID infection following childbirth, and to assess the COVID-19 vaccine uptake during pregnancy by the study participants. We are measuring various study outcomes, and among the maternal and pregnancy outcomes, which are the miscarriage, preterm birth, fetal growth restriction, hemorrhage, maternal morbidity and mortality. The perinatal outcomes include stillbirth, low birth weight, admission to NICU, and early neonatal mortality. Neonatal outcomes include the neonatal morbidity and mortality. The postpartum outcomes include infection and bleeding, and the COVID-19 outcomes include hospitalization, acute respiratory distress syndrome, severity, mortality, and mother-to-child transmission. Next. Study design, as the title was already indicated, it's a prospective longitudinal cohort study of the pregnant women with the SARS-CoV-2 exposure and non-exposure. All pregnant women coming to the participating sites in Sindh, Punjab, Islamabad, and KPK for receiving obstetric care are constituting the sampling frame. Regarding the eligibility criteria, the pregnant women up to the 2 days postpartum at the time of enrollment are eligible to be part of this study. However, the women will be excluded if they are not non-pregnant and if they are unwilling to consent, and those residing out of the catchment area. Regarding the exposure status, the exposed pregnant women will be those having positive PCR or rapid antigen test or detectable COVID antibodies at the time of enrollment or during any time during their follow-up visits. The unexposed pregnant women will be those with the negative testing for the PCR, rapid antigen test, and the COVID antibodies at the time of enrollment and during the follow-ups. Unexposed women with the positive antibodies or any other positive test during their follow-up visits will be transferred to the exposed group. Regarding the sample size of Pakistan, for Pakistan, the total sample size is 5,206, and it is based on the vaccinated and unvaccinated group, as well as on the exposed and unexposed group. We initiated the study from the adoption of the generic protocol of the WHO for Pakistan site according to the available resources and the feasibility. And thereafter, as the intentions of the WHO site office and the SOGP to expand this study countrywide. The assessment of the facilities was carried out and the responsibility was given to Dr. Sadia Ahsan, who visited the leading hospitals in all 4 provinces. And after completion of that process, we've identified and finalized 4 facilities with consultation with her and the WHO office. Regarding the study approvals, initially we obtained approvals at the AKU ERC and the research office and the National Bioethics Committee. And after securing all these approvals and identification of the facilities, and the IRBs at the respective sites were also obtained. Regarding the legal formalities for the MOUs, sub-awards, and the funds transfer, it was a very challenging process for all of us. But today, at where we are present, standing here, is just because of the hard efforts and hard work of all of us. After completing all these steps, we conducted trainings of the research staff, which was initially virtual, and then virtual sessions were followed by the in-person trainings and hands-on practice. We covered topics of the consent seeking and various study protocol, SOPs, and the CRFs. These are some of the photographs of the site visits during the identification of the study sites. So after completing the identification of the process, the final study sites are the AKU main campus along with the 2 secondary hospitals, one in Karachi and the peripheral area and the other one in the Hyderabad. And along with these, we have with us the Jinnah Postgraduate Medical Center, Sir Gangaram Hospital, Pakistan Institute of Medical Sciences, and the Lady Reading Hospital. These are some of the glimpses of the training, virtual training, hands-on practice, and the in-person trainings conducted at the various study sites. So now I'm coming towards the enrollment updates. We started recruitment from the AKU by end of the June, and then the enrollment was followed by the JPMC in end of the September, then Pakistan Institute of Medical Sciences by October end, and from the November, the our class 2 sites, the Lady Reading Hospital and Sir Gangaram Hospital started recruiting the participant in this study. So far, we have screened 3,180 study participants, and of these 3,180, we have enrolled 2,411, which is about a 76%, with a refusal rate of around 24%. If we look at the distribution of the sample across all study sites, we have enrolled 808 participants at the AKU, 401 at JPMC, 355 at the PIMS Hospital, 552 at Lady Reading, and 295 at the Sir Gangaram Hospital. If we look at the enrollment status by month, since we started from the end of the June, so far we are on the expected target, and we are hopeful to complete the entire data collection by December. But if we look at the enrollment of the vaccination status, then there is a huge difference in the vaccinated participants compared to the unvaccinated participants. At the time of starting the study, the unvaccinated group was on a higher side, but with the gradual awareness and increase in the vaccination, now we are receiving and enrolling more vaccinated participants compared to the unvaccinated participants, and which is a challenge for us as well. From the enrolled participants, when we look at by the vaccination status, then we have 53% participants who are the vaccinated compared to the 47% unvaccinated. And as I said earlier that at the beginning of the enrollment, we have a higher number of unvaccinated compared to the vaccinated, but now the picture has changed. And if we look at the group assignment at the enrollment, then from the unvaccinated group of 1131, so far from the available results of around 800, so 76% participants have been characterized as this exposed participant, whereas the 11% are unexposed. But still, we are waiting for the results of the 13% participants. If we look at the vaccinated group of 1280, then unexposed are the 14.6 and 50% are the exposed participants, and still around 36% participants are waiting. So these are the details of the biospecimen at delivery. So far from the exposed participants who are delivered, 435, we have a number of samples taken at the time of delivery. Placenta 89%, cord blood 88%, cervical swab 65%, breast milk 58%, and amniotic fluid 3.5%. From the neonatal samples, we have collected about 92% of the samples, throat swab as well as the anal swab. And based on my presentation now, the way forward is we are moving forward to have a formal contract with the National Institute of Health for the mother to child samples collected at the time of delivery. And these samples are mainly from the Sir Gangaram Hospital, PIMS Hospital, as well as the Lady Reading Hospital. And these samples will be transported to NIH lab where these samples will be tested. And since we have a very limited number of the early trimesters, but I didn't show the data, but we have around 10% of the participants who are in their early trimester and unvaccinated women. So I would like to acknowledge all collaborators, the hospital, all hospitals, administration and finance, research and lab staff, and the data management team, and all those directly or indirectly part of our study. Thank you very much.
Thank you very much, Dr. Salim, and I really apologize for the initial challenge which was faced by you. And I acknowledge those 4 ladies sitting there who are such a vital part of this study. Thank you, Sir Gangaram Hospital, PIMS, JPMC, and Lady Reading Hospital, and WHO Country Office. Dr. Sadia Ehsan Pal is now going to present the SOGP initiative on labor care guide, as well as medical eligibility criteria for contraceptive advice. Dr. Sadia Ehsan Pal.
Okay, thank you. While they're loading the slides, we have 10 minutes left for this session, and then there's a tea break, half an hour tea break. So can I have my slides, please? So I just want to add here, I mean, this is amazing work which is being done, what Dr. Salim presented from AKU and Dr. Sara's team is a lot of hard work against immense odds. I was actually virtually forced to go to these hospitals at the peak of COVID against my husband's wishes and my family's wishes. And they said, I'm crazy. But I did it somehow. They're all friends, so we've had long association. Next slide, please. Okay, so we even forgot the things we have been doing. So one of the things that SOGP just before one of the things we were doing just before the COVID started was the WHO trainings on evidence-based contraception and including the medical eligibility criteria. And I'm just going to briefly tell you about that and the next generation partogram, which we have taken up on our own without any financial support from WHO. So SOGP had a webinar with Sir Arul Kumaran, who was with us yesterday remotely. And he gave a very comprehensive briefing to the SOGP members via Zoom link. And he really implored us that this is the way forward. The WHO partogram needs to be implemented all over Pakistan. And after that, we were really motivated, and I personally wrote to the WHO, the person who's leading this initiative from Geneva, that we would really like to implement this all over Pakistan, and please help us. So they said, we can't help you financially, but they provided us with all the material and links, which are available on the website anyway, for those who want to seek knowledge. So workshops have been held all over Pakistan at an initiative taken by SOGP, Aman, and we have support, financial support from Sami Pharmaceuticals and Abbott, who have published the labor care guide, the partogram, and stacks of them, pads of them have been provided throughout Pakistan to the chapters of SOGP, their heads of departments, so that they have the paper that can be put in the files, and they should start using it. So we held the first training in Karachi. Dr. Khadija is sitting here in her ward, and at the same time at another facility, which New Beginnings. And we had like in a 2-hour program, we were able to do this. And it's not very difficult. Dr. Humaira, please stand up. She has been helping me with this. And Dr. Khadija, can you also stand up for a bit? So she really took the lead, and Humaira has been helping us. And since then, you can sit down now. Since then, Civil Hospital, Dr. Sarah Feroz, if I forget people, please excuse me. We have requests from so many hospitals, Liaquat National, we've already done. Then Lahore Mein, Dr. Rubina did it in her unit. Mariam Iqbal is sitting here. Please stand up so people can see you. They have done. And in Islamabad, yes, I took your name. In Islamabad, Dr. Azra Saidawan, she conducted Dr. And of course, we're doing all this with Dr. Razia's, push, literally. She tells us, हाँ ये अच्छा है, बस कर लो. एक तरह magic wand की तरह से करती हैं. So we've been doing it. And I'm forgetting names, but I've had requests, and these trainings, I think over 40 to ho chuki hongi on partogram so far since September, since Professor Arul Kumaran's lecture. So this is what the giant partogram looks like. It's huge. Humaira, can you show it and keep it here? And this is one that is filled during the workshop, and we show it. We've been doing the partogram workshops for many years. So we just adapted the cases and have started using it. You can see how big it is. This is on with the erasable markers. It's rubbed off after the practice, and another case can be practiced. Yes, and we're holding a workshop on this for midwives and doctors, whoever wants to attend, in tomorrow in Hall C. The whole Hall C throughout the days for midwives. And this is what it looks like. And wherever we're going to do these workshops, we're going to give these to the unit to paste it in their teaching area or labor ward, labor unit, so that the residents, the nurses, everyone can learn on it. Yeah, and we also, with Abbott support, we had a meeting in Bourbon where this was given as a Kaun Banega Crorepati reward to all those who, like a quiz show, and whoever got the answers right got a partogram as a prize. And on the flights back, to their destinations. There were fights going on. Where is my crore rupee ka partogram? Someone's taken it. So it was fun. So I'm Nelly. So this is what it's all about: pain relief and respectful care. Do this and not that. Okay. These were the references given by WHO. So the other thing I'm coming to is the standardization guidelines for policymakers and program managers and tools for healthcare providers published by WHO, which are available on the website. So the four cornerstones of WHO, as they're called. So SOGP, WHO contracted me to do these trainings for SOGP and having SOGP on board. And we were supposed to do like 5 trainings. We were able to do 3 because in Islamabad. And my colleagues are here from Dr. Batul. These are the books that were being distributed, given by WHO in all the workshops. And so we did that in PIMS, we did that in Fauji Foundation and Shifa International Foundation Medical College. Dr. Azra Saidawan from Fauji Foundation took the initiative, while Dr. Nabia Tariq, Professor Nabia Tariq from Shifa International, she took the initiative. And we were very lucky. We have volunteers who came. Dr. Shaida Tarar came from Gujarat to help. Here is a view of the trainings from different institutions, and my colleagues, some of them are sitting in the audience today. And it's heartening how well this was done. And we have 2 pending trainings, one in Azad Kashmir in Muzaffarabad and another one in Gilgit, which we couldn't do because of bad weather, and then COVID started. So those are still pending. Thank you very much.
Thank you, Dr. Sadia. So if the panelists want to contribute one by one, they can, and then I will come to the chairs. About all our initiatives which we are holding with WHO and SOGP.
Okay, thank you. Thank you for inviting me in this panel. Saying about WHO COVID study, it was earlier it was expected to start in February last year, but because of different logistics and hiring of research fellows and pilot study, we started recruiting from September 21. And as Dr. Salim highlighted, that because of increased acceptance of vaccination, maybe we would have been hiring more participants earlier. But the studies, mashallah, is going very well, and we are proud to be a part of this study. And regarding about labor care guide, yes, we Dr. Sadia, we are thankful to her that she conducted workshop in our department. And now the partogram which she has displayed is mounted in our labor room and in our wards, and we are conducting trainings, trickle-down trainings on that partogram, and we are hopeful that we'll take up more.
Thank you.
More. Thank you.
Dr. Batul, few words from you will mean a lot to us.
Thank you so much. And I think it is an honor and privilege to be part of the SOGP team, collaborate with WHO and with AKU. And it has been a great learning experience conducting the study for COVID. And obviously the updates on the contraceptive wheel and on the various methods of family planning. And I would like to just highlight that we did about 24 workshops to celebrate the World Contraception Day in the Rawalpindi Islamabad chapter. Every institution did it. So I think this is the way forward. We all have to own this. SOGP is what we are. The more we work, the better the health of women is going to be. Thank you, SOGP,
Thank you,
for
madam.
giving me this opportunity.
Professor Shamsa.
Thank you so much. We are really privileged to be part of this WHO-sponsored COVID study. And I'm also thankful to SOGP for making us the part of this exciting initiative. Initially, we had the teething problems, but gradually now we are trained, and I think we were the center who started last, but we are catching up. And I hope that once the data is analyzed and results are there, all of us we will learn more about
Thank you,
the
madam.
COVID. And as far as labor care guide is concerned, unfortunately, we are not part of that.
We'll
Thank
start
you.
it. We'll come to you soon, madam. Madam Rehana.
Thank you very much. I must admit, going through COVID, going through so many academic activities, I think SOGBE has achieved milestones which perhaps would be very rare in other parts of the countries, or perhaps I would say throughout the world. I was not expecting so much academic activity going on, with restrictions being imposed, with healthcare services being hampered, with patients reluctant to come to the hospitals. But I think we are going, and I must appreciate the present regime of Professor Razia Kurojo, along with Dr. Paul and Dr. Halima. They have done a commendable job, and I must congratulate them. And also
Thank you.
Aga Khan's team.
Thank you, madam. So my worthy chairpersons, one by one, Madam Lubna and then Dr. Sadia. Dr. Sadia? ये अपना बोल चुकी हैं तो
मैं वर्दी हो गई. Okay. Thank you very much.
मैडम आप वर्दी हैं.
I think as far as the SOGP is concerned, I think over the last 3 years, it's risen to new heights, and there's no two ways about it. The SARS-CoV initiative, an excellent team effort. Aga Khan, well done, girls. I think it was brilliant and much needed. But I have a confession to make. I feel a bit of an imposter sitting here, because I'm perhaps the only person or doctor in the hall who has not physically seen a seriously ill COVID patient. Not that I haven't seen the moderate and this thing ones in my own family, my husband and son getting it twice for obvious reasons, because they don't follow rules. Other than that, my link with COVID has been that I was able to very successfully do a Zoom clinic. So I have contributed in that way. As far as the partogram and all are concerned, I think, countries like us where data collection and other, research is rare, it's best to stick to WHO. And I've very wisely done that since 1995. Because that is work that has been well researched, even in countries like ours. So I think we should just move forward as a team, and
thank
that will work. Thank you.
Professor Sara Salim.
Thank you, Dr. Halima. And it's really a pleasure for us, our research team, to be here and present the great work which we are doing in collaboration with all the, I would say, stars of SOGP and the public sector hospitals. We are working with them. And we are very grateful to SOGP for facilitating this research endeavor. Also the ministry and WHO, the headquarter office, and as well as the in-country office. And also we are getting support in other areas from the regional office as well. So Dr. Batul, Dr. Shamsa, Dr. Rehana, Dr. Khatija, Dr. Halima, we are so grateful to you for your efforts, and we would not have been possible to do it without your support. And it's really, amazing to see how we have made clinicians into researchers. The other youngsters also joining it and helping, and also developing the staff, the data management staff and everything. We are very, very grateful to you. And we are looking forward to having good results, because this is the best opportunity where we can show our country participating in an international study where I think currently there are 6 countries and there will going to be 13 or 14 countries participating in this. And then Pakistan being there is really very important. We have been working with Dr. Halima and Dr. Khadija for few more years on different research studies, and we are benefiting a lot. And I hope Dr. Halima and your hospital is also benefiting from the
Yes.
research endeavors. We are
acknowledge that.
teaching, doing research trainings for your
You are building our
FCPS,
capacity of research and
residents and
ethical
all those
research.
things. So we are looking forward to, and I'm very pleased that we are talking about having a registry. And I remember when you wrote proposal on you, Dr. Atia Abru, and also Qudsiya Uzma on register in a workshop, and developed a proposal on developing a registry, and it's now being implemented and materialized. And I'm looking towards WHO for really helping us furthering it on. Yeah, exactly. Yeah. You are our central staff. So I'll stop here. There are so many things to talk about, but I'm very grateful to everyone, every partner here, and the great teams we have working. And it has actually opened doors for me. And I'm looking also to you to having some research with you. ये मेरी बचपन की ख्वाहिश है, Dr. Khadija sir. So let's and I'm very grateful to you. I must
Thank
say.
you,
I've
madam.
made many
Thank you
friends.
for your very, very intelligent and wise suggestions to SOGP always. Dr. Ellen Thom to give her comments, and then we will conclude and give shields.
Okay.
इसके बाद shield करा.
Thank you so much, Chair. And I would like to thank SOGP for collaborating with us to have this session. You know, COVID-19 has brought its own complexities in our way of living, but also in how we manage women who are pregnant. We would like to commend SOGP for quickly adopting the normative guidance that WHO released earlier when COVID had just started on how to manage women, pregnant women with COVID-19. They collaborated with us and the Ministry of Health, and we through virtual meetings, finally agreed with most of the stakeholders and disseminated the COVID-19 guidelines on management of pregnancy. We are also grateful to AKU for the collaborative study that we are doing with the public sector hospitals on COVID-19, which will provide us with the evidence that WHO needs to give the normative guidance that periodically come out on various issues, including management of pregnancy. We are also committed this year to support the labor care guide. So we would need further discussion with SOGP on how we can take the labor care guide forward. We are grateful to SOGP in their own way for running with the labor care guide after it was released by WHO some years back. And we would like to come in this year and support the rollout of the use of labor care guide in Pakistan. That also goes with the registry. We, as WHO, are interested to help with the registry, and we'll have further discussions with SOGP on this. So thank you very much for the session. WHO is here to support on all issues of COVID-19 and all issues of obstetrics and gynecology. Thank you so much.
Now I will request President SOGP, Professor Razia Kurejo, to award the shields to the speakers of the session, also to chairs and panelists. Dr. Razia. Dr. Salim Jasani. The panelists of the session, Dr. Professor Khadija Bano. Professor Khadija Bano. कहाँ से? कहाँ से? किसको बनाने वाले? Professor Batul Mazhar, Professor Rehana Rahim, Professor Shamsa Humayun, Professor Shamsa Humayun, the chairs of the session. You're not staying for the shield? Chairs of the session, Professor Sara Salim. Professor Sara Salim. Dr. Razia is going to award a shield and Ajrak to Professor Sara Salim. Professor Lubna Hassan. Our beloved. Dr. Alan Thome, thank you for traveling for this session, Dr. Alan. Ji, Dr. Razia is putting up Ajrak to Dr. Alan Thome, a traditional drape. Dr. Sadia Hassan Pal to receive her shield as a chair. Dr. Sadia to receive her shield. Thank you. So can we have a group photo for the session and then we have to leave for the tea break?